typically onset for a lot of obsessive compulsive disorders around the age of, like, right around puberty. So right around the age of 12, 13 is very often we'll see the onset, but it's not the only onset. Um, Same thing with, depending on, anxiety is a little bit different, so it depends. So very often anxiety can be because of a specific event. So if I have a negative experience flying, that might start my fear of flying, and that could be at any age. We have children as young as 4 or 5 who might come in with an anxiety or OCD disorder. And we have people coming in much later as well, into seniors where they have something like this occur. So the range is pretty broad. Um, in regards to, we see slightly more females than males for a lot of the anxiety disorders. Males, we see a lot more of what we call, pervasive developmental disorders like autism and learning disabilities. We see more commonly in males than females. But we see them, it's onset's can be relatively young, and there's the best way to probably think about it is probably a combination of both genetics, as well as environment. So when we talk about like a stress diathesis model, is I might be predisposed, biologically. So my father is diabetic, so I have a 25% chance of becoming diabetic. That can be affected, however, by my environment and what I do. So if I sit around all day on the couch and eat deep fried lard, I'm much more likely to increase the likelihood of me getting diabetes. If I have relatively good, nutrition and exercise habit, I can decrease it, but I still might get it anyways because that 25% just might be enough. So we'll see a lot of that in the same thing with anxiety and mood disorders, as well as OCD would be what's in the environment. So anything from what's being modeled by my parents. So if we have anxious parents, we're likely to have anxious kids. If mom can't handle being around the dog, there's no way I can because mom's bigger and stronger than I am. So I'm learning mom can't handle this, I can't handle it. If mom gets easily overwhelmed and has lots of what ifs, then the world is a scary place. So some of it's modeled. Some of it just might be biology, as well as stressors. So some people, break out in acne, other people are going to have panic attacks. So, so as we look at these things, we're trying to figure out not only kind of what the cause is, but in terms of when we talk about treatment, it's more about how do we deal with those issues. It's good to kind of understand where it comes from, but even if we know where it comes from, that doesn't solve the problem. We actually need to actually make significant shifts on how we think and how we behave around those.